I'm Mary Costantino. I'm an interventional radiologist. I finished medical school in 2001, finished residency in 2006, and went on to do an IR fellowship at Georgetown University with one of the great leaders in fibroid embolization in the world, Dr. Jim Spies. I started the interventional radiology program at Epic Imaging just under 3 years ago. I've really enjoyed growing this fibroid practice in Portland. I find that in Portland, the physicians and naturopaths really do have the patient's best interest in mind. This has been really the perfect spot for me. With such a good team, we're able to really provide the greatest care to every patient. Often we get the MRI right before the consultation, and we'll go over your images. It's one appointment, it gets everything done. You leave that day with a plan. I've never been the kind of interventional radiologist who has just done procedures. I've always been very involved in patients leading up to the procedure, the time of the procedure, and then after the procedure. All my patients have my cell phone number, and I always will respond to them. I think the clinical part of interventional radiology is so important, and it's always been part of what I've done. And I think that is a big difference between having a successful UAE versus an unsuccessful UAE in the eyes of the patient, is how much care they feel around the time of the procedure. I've initially got interested in fibroid embolization back in medical school, where I did research on the first set of patients that were done in the United States at UCLA. Fibroids are really prevalent and result in a lot of hysterectomies. I think it's really important that patients are educated about all their treatment options. And that's one of the most important things that we do as providers, is to sit down with patients and talk to them and try to get a sense, even if they don't know what they want to do, try to get a sense of where they're headed. Does the patient work? Can she be out of work for 4 to 6 weeks or not? Are there young children at home she has to take care of? There are many women who, they don't know why, but they're just not comfortable with the options that are presented to them. And often when they're sitting in my office, we can sort of tease out these issues, and going through the pluses and minuses of every procedure. Once patients become educated, they're really empowered to choose what's right for them. Educate, empower, enjoy life.